Hello everyone, we will start in a few moments. We'll just give time for everyone to join. Welcome to Health Tourism After COVID-19, the road ahead updated. My name is Romilly Douglas and I'll be your moderator. I'm pleased to introduce today's speakers, Irving Stackpole and Laszlo Putzko. Irving is the president of Stackpole Associates, a strategy, marketing and research firm founded in 1991. Irving is a mentor for the European Institute for Innovation in Health, an EU program to stimulate healthcare entrepreneurship. He edited Medical Tourism Marketing, the first book on the subject, and is the co-author of the Marketing Handbook in Health Tourism. Laszlo graduated as an economist specializing in tourism from Budapest University of Economics and holds a PhD on the environmental impact of tourism from Budapest University of Economics. He is a certified management consultant and a past president of the Association of Tourism Consultants in Hungary, CEO and co-founder of the Health Tourism Worldwide. Both Irving and Laszlo have with decades of experience in health, tourism, wellness. Before I hand the mic over to Laszlo, I have a few housekeeping items to cover about this presentation. First, today's webinar is being recorded and will be made available via email to all participants after the webinar for further review and sharing. We'd love to hear from you during today's presentation and we'll be answering questions at the end of the session. If you have a question for our speakers, please feel free to send it through the Ask a Question tab at the bottom of your player. And if your question is for a specific speaker, please let me know. If we don't get to your question during today's webinar, we'll be sure to follow up afterwards. So without any further ado, I'd like to kick things off by welcoming Laszlo. Thank you.
Thank you very much, Romilly, and very welcome, everybody, and good morning or good afternoon, good evening, because knowing the list of attendees, we have a large number of people from all around the world, every corner of the world. So we appreciate your interest and your support. And we believe, as you know, this is not the first time that we talk about this topic. And even ever since we had the first session, so many things changed. We thought that would be really the time to revisit the discussion and keep you updated on the developments and how strategies, activities, product developments can be influenced and can be fine-tuned to the expected opening up after the virus. Just very briefly, those who don't yet know me, this is the short summary of what I personally have been doing, the experience in anything related to health and well-being, and the combination of that to and with travel for 25 years. Many of which, all those activities being at private sector levels, many of those also public sector level. And I'm very happy that I could have an understanding of the spectrum of well-being from the wellness side to the medical side. I'm going to talk about some key issues and key topics, as well as some obscure developments, especially about the wellness side, and then I will pass the microphone on then later on to Irving, who will address the medical tourism aspects. I think it's important that we all understand the same approach, and we are very much aligned. So just very, very briefly, we understand health tourism as an umbrella term That includes medical tourism and includes wellness tourism, with a little bit of an overlap between the two. This is how we look at the industry, or the scene, if you wish, because now we can observe there is convergence between the medical side, the traditional medical side, and the wellness side, and the lines are less and less clear and more like blurred, which gives more opportunities, obviously, but also certain challenges, because we need to have a better understanding of both ends of the spectrum. I think we have to agree that there are a large number of services and programs that can be incorporated into any travel activity, since we understand that travel as such contributes to your well-being, and you feel better even if you go to a business trip, if you have a cultural visit, if you have visiting friends and family, gastronomic trip, doesn't matter what it is, it contributes to your well-being. It doesn't make you a health tourist, because you would need to be doing either a medical activity or awareness activity as a core expectation, as a core motivation. But we understand, and this is where the whole industry, the travel industry and leisure industry has great opportunities, and then I would need to include the healthcare as well, that we need to look at how services, options, opportunities can be added to the current service options and service menus that can improve our guests' well-being. So that's what you can see on the one side of this little chart, which is the well-being improving options to any kind of traveler. And the other side is those who are core health tourists, either for the medical side or for the wellness side. Probably I need to highlight just one little item here, which is a motivational definition, which is what we call a self-gifting, since often that's more like a wellness trip, but we also understand that having new breasts, often, although it would be a medical intervention, but it's a self-gifting activity. So the motivational side comes from a very different angle. My overview in the next 15 minutes, it will be very much looking into the motivational aspects and less so on the infrastructural aspects. If you look at brochures, if you look at advisors' websites, if you look at operators' websites, everybody will tell you that I have 5 pools, I have 10 saunas, I have 12 treatment beds, and I have 3 yoga decks, which are all fantastic and all very nice. But especially after the COVID, when people will have a different understanding of travel, different understanding of health risks, different understanding of satisfaction as well, they would really need to find out that you are offering something which is really related to their core motivation, not just telling them that you have certain elements of infrastructure. I will give you examples of that. We also understand, and I don't think it's ever been more important than now, that we need to look at health span and not lifespan. When we talk about health travel, health motivated travel, even the World Health Organization has been suggesting now for quite some time that we need to move on from the lifespan understanding, that how many years we are living, how many years we have more left. We more need to understand that whatever we have left, whatever we are doing, it would need to be more health conscious. That's a very different understanding, not just how the societies will look at themselves, but how operators, as well as destination management bodies and governments, because I know you have government representatives here tonight as well, we need to consider how the health aspects, how the healthy services, how the well-being improving components can be and should be incorporated to pretty much any kind of travel, and how the health conscious travelers, either medical or wellness, can be further improved and provide more something which is local and based on local resources. I don't know how many of you have been involved in experience creation and development. This is my little toy. I absolutely love it. To create these experiences, and I would like to quote just 1 or 2 approaches here, because they have been changing significantly due to the COVID. And one is the pre-COVID approach, where we call it the 3S model, which is satisfaction, surprise, and sacrifice. We used to want satisfaction, we wanted to have surprise, and we had very little sacrifice. Especially for wellness trips, it's often very standard. We have cheap tickets. We want to have high degree of satisfaction, high degree of surprise, but we don't want to sacrifice much. Obviously, after the post-COVID, we will have a very different scenario, at least short term. We will have a large chunk of these 3 S's now dedicated to sacrifice. It's perceptions, it's destinations, it's time, it's health risks. So first of all, the barriers will be the sacrifice and not the not high enough satisfaction. That requires a different kind of communication, different kind of segmenting, different kind of value propositioning. That's what I would really invite all of you to revisit, and feel free to ask questions now or even later, even off this webinar, because this is a massive challenge. There's a very different way of looking at our own services and looking at our demand. And probably just to elevate the mood a little, and since it's evening to many of us, you know, that's probably a face mask that guests, especially those who are the hedonistic end, would like to wear. I know it's very stupid, I know it's not very health motivating, but don't forget, enjoying a good glass of wine also contributes to your well-being, and how you can do that when you're wearing a mask. You have to really think about it, how much of the satisfaction may go away and becomes a sacrifice. This is a little bit, with Irving, we have been discussing this, it probably is a little bit too complicated chart, but I really wanted to discuss it with you, at least to raise the point, and then we can revisit it a little bit later even. Since it's understood that based on all the webinars and all the forecast research companies, that travelers will look into distance, we look into the location, we look into brands, and we look into desires. And based on all these parameters, I just want to list the key issues here. And these are: do you travel short or somewhere close because you're worried you may not be able to come back, or you want to go far because you want to be remote? You will go to brands which are unknown because you think it's small, it's boutique, you understand that it wouldn't be too many people, or you want to go to big brands saying that they have the new protocol of relevant protocol of cleaning processes, and you trust it. You want to be a place which is popular and busy because then you have all the services should anything happen, or you want to be secluded and being far away. Or, as a last parameter, you want to go to which is tried and proven. You've been there, you know how it goes, you know the drills, you don't want any, again, don't want any surprise, want to minimize your sacrifice. Or you say, oh God, I really don't know when I can travel again. As soon as I am physically possible, I will look at my bucket list and I start to travel. And how the health travel will fit in this segmentation approach. And obviously, you might say that I would like to play around with those units, and it's long and tried, or far and bucket list. How can I do that? And obviously, we have this is what you need to do, and this is what you need a little bit of help with advisors. I have to tell to you, since this can be one option that you change it around a little, but soon you might find out that your wellness guests actually want to go somewhere which are far away on the bucket list, and they still want to have no brands whatsoever. And this is what you need to work on. We need to understand your guests in a very different way. And we have 4 options here. If nothing else, try to remember these. You can create wellness illusions, which is basically just you relabeling your spa into a wellness unit, or you wellnessify the whole process of your activity. So every single aspect of your services would be looked at and recreated. You can have wellness entertainment, which is basically just entertain under the wellness umbrella. You will see the example in a minute. Or you decide that you want to be an eminent in wellness, we call it Wellness, and you want to focus on one aspect of the wellness approach, and you do have everything in the forest, and you do the forest bathing, and you do the energy of the space and everything focused on that, and you have the yoga decks in the forest and so on. So eminent in one aspect, you don't care about the others. You have to make decisions. Neither of them is better or worse. They are choices. You need to look into what you have on site, what you have as a brand, what you have as guests, what you used to have as guests, and what you want to have as guests, what you want to have as brand, and want to develop. I really invite all of you to try to identify your existing services and also your directions and options that you have in front of you. All right. These are, I'll give you a couple of examples, and one specific photo will be or could be disturbing to certain people here, and I'm already sorry about that, and pardon for this very direct imagery, but I really wanted to tell you that this is a situation where if you wanted to create wellness experiences, now you can have wellness tuna. I don't know if you tried wellness tuna and how it is a tuna which actually was well, or you would be well eating that kind of tuna, or both, but it doesn't matter. You have a great challenge from the consumer world, from any part of the world, which would really challenge your core wellness propositioning. That's why you need to visit which of those 4 directions you can do, because now you can buy a wellness tuna. You can do, this is what we call Prenomes sunning, and this is the photo that, should you be offended by that, I'm really sorry about this, but you really need to be aware what your challenges are. And it's basically showing your private paths to the sun, because this is the best way of taking energy in. It's very peculiar, it's very weird, but well, this is what, let's say, the influencers have been banging on recently. Is it really wellness? Is it just well-entertainment? Or is it just a little bit of illusion? It's up to you to decide, but we need to know that you have to identify your opportunities and your real market. There's nothing wrong about this. It doesn't harm anyone. It's weird, and not everybody would be very comfortable with doing this. But this is what's happening in the market, apart from just having a treatment room and a couple of treatment beds. This is also part of the wellness proposition as we speak. So as this, which is a traditional healing activity in Japan, with the volcanic activities heating the sand, the black sand from under, and you need to have the umbrella, otherwise you may be burnt, and in Asia it's not something that you would be doing intentionally. But is it entertainment? Is it healing process? Is it a heritage activity? Is it tradition? Is it a natural healing process? What is this? You really have to make your homework and to understand and list your opportunities, and then introduce them appropriately to the segment that would appreciate this. Some people will come here because it's fun, it's entertaining, it's Instagrammable. Some others also will come because understand the benefits of it. But both of those segments can come, and even a couple more as well. It's your choice which of those guests you actually want to keep and want to push to. So, summary, and soon passing on to Irving, I really invite you all to look into, I'm sure most of you know what UX is user experience, but we believe it's more like well-being experiences, and even more appropriately, responsible well-being experiences. You need to create those. They don't just happen. You have to orchestrate them. They are guest journeys, they are stories, they are rituals. We have to create them. We have to introduce them. That's a very different world from just operating a spa or having a couple of treatment rooms. So remember, to achieve all this, we suggest you to understand your unique value propositions, not unique selling propositions, more like unique value propositions. Have mentors, not only advisors, but mentors who can help you to implement. I'm sure many of you would have lovely ideas from today, from other webinars as well, from other stories, reports, but the trick is how you can implement those ideas to your very special situations. You need mentors to help and to help you through the changes of the implementation and the development. And also, what are your stories? These are not just images. What you are standing for? What is the core story that guests can be related to? Guests can take home and can find themselves in that story. Again, it sounds very simple and very easy, but believe me, that's really isn't. Working on 4 continents, it's a very difficult job. It's a beautiful job, but it really takes time. And probably, since the business is still hasn't yet picked up, probably this is a time that we can and should be revisiting this. So often people say that health tourism luxury. If you ask me, it would be more like a necessary luxury, luxury necessity, but a necessary luxury item. We all need that, and we all need to pursue that. But probably, or more like absolutely true, we need to look at it in a very different way. Some of these things will be expelled more in the upcoming book that we wrote with Irving. And we give you exercises and tasks that you can follow, and then you can engage a discussion with us. And we will be more than happy to help you with your development and your journey. I'm sure I know it's a bingo item, not talking you're having a journey, but really this is a journey, because we have to talk to our guests in a very different way. And you will find out that even those who wouldn't even come close to a spa, as soon as they understand what the well-being improving benefit of your service can be, they would come and engage and take that opportunity, even if it's not a spa, if it's not a wellness center. But since you understand the whole process of the well-being experience creation, your opportunities will be way wider, and your guests would have a way more fulfilling and well-being improving experience. I believe this is the moment to give back the presentation to Irving, and he's taking on to the medical tourism side. Thank you.
Thank you, Laszlo. I think I'm supposed to take this over, and I'm going to trust that you all can see my screen. Thank you, Laszlo. Thank you, Romilly, and thank you all for being here. We were flattered and a little overwhelmed with how many folks signed up for this program. We were flattered and a little overwhelmed the last time, and almost twice as flattered and twice as overwhelmed this time. My hope is to take a few minutes and run through what I believe to be critical market dynamics regarding medical tourism, health tourism in the post-COVID time. You can see here the reference to the book. It was a treat participating with Laszlo in the development of the book, and just as we were about to publish it, of course, COVID hit, and we were very encouraged to see that the vast majority of the content was relevant even in the COVID-19 environment, which speaks to the need for fundamental information about marketing. And that's our background at Stackpole Associates, a long time healthcare and seniors housing. For this particular presentation, I'd like to focus on more external factors and market dynamics than in particular service lines, although I will delve a little into which service lines, in my considered opinion, will emerge first and which will emerge most slowly. But the factors in the health tourism and medical tourism markets and in the healthcare markets are, first of all, the external factors. And we understand what an external factor is now that we've encountered the novel coronavirus and COVID-19. That is an external factor, along with the imposed travel restrictions. One cannot have health tourism if one can't get from point A to point B. And then that changes as travel restrictions are lifted. How will that impact health tourism. I will address that. Demand, supply and demand drive all markets. The demand for health tourism is driven by both the travel markets, the demand in the travel markets, as well as the psychology that's dominant at the moment and the psychology that's likely to emerge as the markets break free from its current deep freeze. Supply and capacity will also be affected. The supply of health-related providers, will they be there when the health travelers are looking for them? Some health providers, some wellness providers, some medical services providers will not survive the current economic contraction. So how we do that, how we manage to navigate the difficult times that we're going through now may make the difference in some cases between those who have capacity and are available for health consumers as they look up and look around, and those that, for a variety of reasons, may not survive this time. And then what is the road to recovery? What does it look like? We've used this graph in prior presentations, so if you're too familiar with it, forgive me. I haven't really gilded the lily here. I'm showing the relationship between the frequency of a certain service on the left-hand side of the graph and the acuity or complexity of the service on the other side of the graph. And as you can see here, the market for health tourism breaks down into two major market segments. The low acuity, high frequency side of this graph, and that's in large measure the types of services and markets, supply and demand that Laszlo is referring to. And then the other side, which is the highly complex, but relatively speaking, lower volume, higher unit value sides of the graph. So one side of the graph refers to high volume, low unit value, and the other side of the graph refers to low volume, high unit value. In the classic, or not so classic, but in the medical tourism literature and many of the studies, the focus is on this low volume, high unit value side of the market. But I can assure you, and Laszlo has testified, that the high volume, low unit value is by far the larger part of the health tourism market globally overall. The market factors, the dominant components, are destination stability, and this boils down to perception. There are a variety of measures of destination stability, but the bottom line at this juncture has to do with consumer perception. Is your destination seen as being safe? Not safe in a physical security perspective, but clean. What's the risk that I'm going to get sick by traveling to your destination? And then baked into that question is, of course, access and travel. Can I get to your destination? Which is a critical question these days. In the travel industry, as well as in the health tourism markets, there's quite a discussion about how markets are opening back up, how travel to where I live in Portugal, for example, is beginning to open up from certain source locations, and travel to other destinations is beginning to open up. Who's opening up and where the restrictions remain? These are a complex array of issues that a consumer would have to navigate if she were interested in getting from point A to point B in order to consume your health and wellness services. Another component that's always an issue has to do with economics, and in this context, it has to do with inflation. We are, by all standards on the brink of significant global inflation, whereas we've had an extraordinary period of stability. We will see significant inflation. We'll see certainly recessions in many developed economies, in most economies. And how will that impact purchase power parity? How will it impact my ability with my euros to purchase services in the United States or in Argentina? The next item is capacity. This tragic and difficult pandemic has significantly impacted the capacity of service providers to deliver health and wellness services. Some hospitals, some clinics remained closed, either through external orders or because their staffing isn't available, or because the hospital or clinic hasn't yet made the pivot, the transition from meeting urgent pandemic-related demand to returning to elective procedures. And then finally, and enormously important, is your reputation and your brand. What is the dominant opinion held of your destination? What is the dominant opinion of you as a healthcare provider? What are those opinions among your key audiences? These are critical questions and will be extraordinarily and newly important as we progress out of the deep freeze of COVID-19 into a recovery period and a thawing of the markets. So one of the issues in a health tourism conversation has to be about tourism and about the travel and the dynamics of travel in these markets. And this is very recent data from Flight Radar 24. You can all access this. It's a fascinating tracker. It keeps track of all of the airplanes that are in the sky around the world at any given point in time. And you can see that after emergency lockdown orders were imposed, the number of commercial flights plummeted to a low at about April 18th and is still remained low, but you can see there's just a little uptick there on June 2nd. This is a 7-day moving average. I know personally, I live in the flight path of the airplanes going into and out of Lisbon Airport, and recently over the past few days, we've actually begun to hear airplanes again, which is a treat. To put this in historical context, this is a chart that shows the 7-day moving average of total flights from May 2016 to March 2020. And you can see here how after the global lockdown, the World Health Organization and other governmental organizations declaring emergency, the number of flights plummeted dramatically. So if you can't get from point A to point B, that's immediately an issue with access in these markets. So how will this change? What will happen? So there was a famous study done by the EU back in 2006 that predicted that in the case of a pandemic, and yes, they actually did do a very in-depth study of this, that they anticipated, the sophisticated researchers of the time predicted a V-shaped recovery from a pandemic event in the EU and globally. And in a V-shaped recovery, one would see a dramatic decline, but a rapid return to something like normal. The other type of recovery is a U-shaped recovery, which is the kind of recovery we had after the 2008-2009 Great Recession. What we can expect, however, in this case is neither a V or a U, but something more like a Nike swoosh, as can be seen here from the estimates or projections by the World Travel and Trade Council. I think I got that, World Tourism and Trade Council analysis showing that it would be more like a Nike swoosh, depending on when the lockdowns were relinquished. What this doesn't take into account is any resurgence or flare-up in infections in any particular location. So my hunch is that there will be some flare-ups in some locations, in some destination locations, which will cause some return to lockdown. So I think we're going to see a period of release, lockdown. So the recovery is going to be more like a jagged swoosh and a gradual return. Some things won't return. So the impact on capacity in this pandemic has been significant because supply, healthcare resources was diverted to serve the demand for COVID-19 treatments. So there was a period where few elective non-urgent procedures were scheduled. And the question is, can we turn the faucet back on? And the best thinking about this is that some percentage, some proportion of what had been a very robust elective market for health and wellness services, some percentage of that will not come back for reasons that we can talk about. But in order to adapt, that we as providers and we as destination managers, management organizations need to adapt to those changes, not necessarily fight against them or wail against them, but to actually adapt to the opportunities that those changes present. Recent article from The Economist described tens of millions of surgeries are being postponed as the result of a pandemic, which immediately creates the question, well, when you open the floodgates back up, that's going to create a surge of pent-up demand. Well, yes, there may be surges in certain categories, but as I said earlier, for sustainable growth, there may be some portion of the mid-market that will not return because alternatives have been found or because of the psychology and behaviors that have been impacted by the pandemic and the intense communications, the intense media messages around this. Cases of coronavirus here where I live in Europe, you can see this heat map that shows where the cases have been dominant. And in certain countries, France, Spain, Italy, all the respect in the world to those in the audience from those countries, they have been very hard hit by this illness, and especially with regards to deaths and the way the illness has impacted its capacity. Contiguous countries, smaller countries where the illness hasn't impacted it as deeply, these countries, these destinations may have a story to weave about their comparative safety and comfort. So the question is, to borrow a theme from an old movie, if you build it, they will come. If you clean it, will they come? If you create deep cleaning protocols and convey narrative and messages and use symbols to communicate that your place is clean, that your clinic is at the state of the art for standards of cleanliness. I know that there are a number of organizations that are offering these standards now. For example, TIMOS is offering an industry-leading set of standards around cleanliness in the post-COVID period. We'll see more of these emerge. Are they going to be enough? So what it's going to take is really testing, and I have a demonstration here. So testing, to quote SpongeBob, is going to be extraordinarily important. Testing will become pivotal to how a destination conveys its safety. Certain types of testing have already gotten into some trouble in that they have proven not to be as reliable as had been hoped and expected. So how these factors, testing, perceived cleanliness, access, how these are navigated by destinations and providers is represented or alluded to in this type of relationship. Acuity, provider, and destination. For consumers at the low acuity end of the scale, the destination is far more important than for consumers at the high acuity end of the scale. My common joke about this is certainly not a joke, but my common reference about this is that one would not go to Rochester, Minnesota in the dead of winter for serious surgery, but you would go to Mayo Clinic, which happens to be in Rochester, Minnesota, and in the dead of winter is a particularly challenging place. But if you were going for a cosmetic, possibly a non-invasive treatment, you would want to go to a place that was far more appealing, far more in aligned with your desired agenda for for health and wellness. So going back to this segmentation model, where I believe, based on our research and experience and our conversations with providers and governments to date, seem to indicate that the vanity/hedonism end of the market, of the frequency and acuity market, will come back very quickly. This demand for looking good has been pent up. I see a surge in demand for hair transplants, cosmetic procedures, weight loss procedures, and certain other procedures. And in environments where the control upon visitation, the control upon inbound travelers are very strict, it will be very interesting to see how that mitigates or how that dilutes the rate of return to normal, or the rate of growth of consumption in those marketplace areas. I'm thinking in particular of the Gangnam in Seoul and the return of the cosmetic surgery markets there. The high acuity market, the demand for immediate exigent services is certainly there, and will be also among the earliest segments of the market to come back. We're going to have a tentative re-engagement by consumers. We're going to see local travel before distant travel. We're going to see first vanity and hedonism market segments come back. We're going to see second, very high acuity market services come back. And third, and slowly, will be the middle market. And some portion of the middle market will not return. It has either moved on, it has developed new tolerance for whatever it was it would have sought its services for in the past, or it has re-engaged with telehealth, telemedicine, and novel ways of resolving its that consumer category's demands for services. We're going to see extraordinarily tentative attitudes among a vast majority of the consumer markets. In the segmentations that Stackpole Associates have done of consumer markets over time, we used to see around 12 to 20% of market being what we would refer to as fretful warriors, people who are always worrying and are fretful about every detail. We think that temporarily we may see 40%, 50% of the market being fretful warriors. And how we address those individuals without being condescending or without dismissing their concerns is going to be very revealing and extraordinarily important. Another extremely important component to re-engagement will be telehealth, telesolutions to the particular challenges that consumers are facing. And the big issue is fear versus risk tolerance. How we segment our markets based on these characteristics will determine which destinations and which consumers will move ahead, frankly, at the expense of others, because many of the markets will open up very slowly. So with that, I'm going to shift over. I believe do I need to do something here, Romilly, to shift over and share, stop showing screen, change presenter, change it back to you. Can't hear you.
Thank you. Can you now hear me? Thank you, Irving. We're going to now open the Q&A session. So, thank you all for your questions. This question is for both of you. Will the US impose restrictions for traveling and for medical travel?
Well, there's the short answer is probably. What restrictions are in place now? They are being lifted, but there are still, as far as I know, significant controls in place. I've seen pictures of major airports in the United States that look like big empty halls, which is really they are without the people. And I expect to see some biometric monitoring at key entry points, and who knows, I hate to say this because I don't want to politicize it, but given the geopolitical tensions between the United States and many other potential source locations, I think that there will be some politicization of entry into the United States for any purpose, including health tourism. What are your thoughts about that, Laszlo? We can't hear you, Laszlo.
Yeah, I was muted. Sorry about that. That I think is going to be a very political question, not a business question at the moment. I think it's not just US necessarily, but other countries as well. That's also it's a healthcare related issue, but sadly, in many countries, it's become a political issue as well, and the tool. I really, honestly, I don't know, and that's I think it's very early stage, especially given the uncertain situation in many cities. I think not just because of the COVID, but also for the because of the sad events that we have seen the last couple of days. I think it's too early to even anticipate.
Thank you. Here's another one for you, Laszlo. Is the 3S model based on facts and research? Laszlo?
The question was so tough, it locked him up.
He's frozen.
I can respond until Laszlo comes back. Yes, it's based on empirical research associated with patient satisfaction and its correlates. So there is good behavioral research behind the 3S model. And to another question or another point that I read in the attendee question list, and thank you for all these wonderful questions. The term sacrifice doesn't refer to anything necessarily religious or spiritual. It has to do with what you have to give up to get the benefit. So if I have to travel from my home in Lisbon to an obscure village in central Argentina to take advantage of goat yoga, I have to give up a lot to get that benefit. So that usually that kind of cost is baked into what's considered quote unquote price. But Laszlo and others, Laszlo didn't invent this, but he's leveraging it, I think, intelligently. He's referring to that as a component of this mix that we need to look at in segmenting our consumer and customer database, our consumer and customer data.
Thank you, Irving. There's another question here from Costa Rica. How do both speakers feel about the COVID-19 free certifications?
Okay, what a great question. First of all. Second of all, pura vida, love Costa Rica. And the certifications are symbols. Certain certifications come from organizations that have significant substance and heft behind them. Some certifications are nothing more than stickers that are applied to willing vendor windows or willing websites. So if I know that, then risk-averse consumers will research these certificates. And I think we're going to see a growth in consumer understanding of and sophistication about certification credentialing. And we will see that consumers will be able to pull back the veil and see which certifications are substantive and which ones are merely window dressing. So that's my view on certifications. I think the symbols are important, and I think the substance behind the symbols will become progressively more important as these markets open up and as consumers get better educated and better self-informed about what they mean.
Thank you. So next question for you, Irving. I think we've lost Laszlo for a little bit here, but we'll keep going. So could you expand a bit more why telehealth is in the low part of T engagement? My guess is that on the contrary, due to travel restrictions, these types of services will grow fast and early.
Yes, they already have grown fast and very early. NHS, CMS in the UK and the US have put a lot of heft. First of all, a lot of the barriers, historical barriers associated with telehealth, telemedicine, were removed, diluted, or perforated to allow providers and consumers to go online with each other in far more widely and at a significantly greater degree than ever before. And that genie's not going back in the bottle. Consumers like being able to talk to their provider on the phone, to show them their boo-boo, get a prescription handled, or just say, take an aspirin and call me in the morning, to interact with their provider. That's absolutely huge. And the evidence for this is all over the place. The biggest one is that there's been a positive explosion in the number of quote unquote telehealth platforms that are available for providers around. So the early market entrants to that space were playing by a very complicated set of rules, governmentally imposed regulations and rules. And there's risk here that those early market entrants will be eclipsed by, like leapfrogged by some of these new, faster, more agile market entrants. But we will see significant additional growth in telehealth, in telemedicine, and their applications, teleconsultation. The degree of the number or proportion of people who got second surgical opinions, for example, used to be relatively modest. And now that number is going to grow significantly. So when I referenced, I put it at the bottom of the list, I wasn't putting it at the bottom of the list. I was including it as an extraordinarily significant and important new dimension in these market dynamics.
Thank you. We're here now. I've got another one. So will medical visa and COVID test become the new normal for medical travelers?
Wow.
What are the trends for leading medical tourism countries in creating business drive? I rarely see the trend in this year that the medical tourism or wellness tourism will return.
Okay, so the end of the question has to do with the markets returning, and the markets will return. The question is how quickly, and how quickly they return is dependent on the usual sort of market variables, but also whether or not over the next few months in a particular destination location or the source location, if there are any resurgences of the virus. So if there are upticks in cases in a destination location and there's a requirement to reinstitute lockdowns in that location, or vice versa, that will immediately crimp or stem the flow of consumers in that pathway. Remember, the health tourism markets overall globally are heavily regionalized, and in that regionalization, which may be altered because of the coronavirus, which is a very interesting question we haven't delved into yet, maybe on the next webinar we will, but in that regionalization, there will be expansion and contraction, and to the extent that the destination locations are able to implement biometric screening, testing on arrival, security around isolation for individuals who reflect any early symptoms. To the extent that they're able to do that, they will protect that flow, that regional flow of consumers. To the first point in this person's question, there are these suggestions of having immunity passports. They've been labeled, which is a very interesting idea. In Wuhan, where this particular virus emerged, the consumers, the individuals in Wuhan on their mobile phones have an app that's either green, yellow, or red. And if you're green, you can go wherever you want to go. You can go into the grocery store, you can go into the Apple store, you can go into the office building. If it's yellow or red, you cannot. So, but we don't live in that environment. Some people have suggested that on passports, we'll get a sticker that is good for a certain period of time. I just don't know logistically how that would work. And other people have suggested other tools that could be used. There's some very interesting technology emerging in this regard. But again, this isn't a technology discussion. It's really a market-based discussion.
Thank you very much. We're just going to a couple more questions before we wrap up here. So next one for you. With the protest that is happening throughout the US cities, what do you think is the world's perception of the US as a destination at this time? Do you think that the US will be able to overcome any negative perceptions, and how long do you think it will take for a positive perception to happen?
Okay, so this is a very good question with regards to branding. So, and this also goes back to the chart that I showed about the relationship between the acuity of the services that you're seeking and the importance of the destination. If you're looking to have a blepharoplasty done and have your eyelid, whatever, if you're looking to have a simple cosmetic procedure done, you're probably not going to go to the United States unless you're extraordinarily wealthy. If you're looking to have your third heart valve replacement and you've got other comorbidities, of course you want to go to Mayo, you want to go to Stanford, you want to go to the Mass General, you want to go to Emory, you want to go to a place where you feel safe and secure and where the complexity is met by the sophistication of the provider. But in that case, Rochester, Minnesota, Stanford, California, Boston, Massachusetts, Atlanta, Georgia, they're less important than the provider themselves. This disruption, and welcome back, Laszlo. It doesn't sound like we've made too much progress since you left and returned. This disruption in the U.S. Cities will remedy. It will be resolved. What the long-term impact of that will be is anybody's guess. But in terms of world-class healthcare, the United States has its tertiary and quaternary systems are among the best in the world. It's academic medical centers, the ones I just rattled off, are among the best in the world. So there will always be demand to that extent. How America's image in the world is damaged or affected by these protests, I believe those of you who are on the line understand my political leanings, and you could probably anticipate my answer, but I'm going to restrain myself.
Thank you. Welcome back, Laszlo. I've got a question for
Sorry about
you. Not a problem. So, question for you is, what do you mean when you say wellness tourism must be luxury? What kind of luxury are you talking about, and can you give an example?
Well, it's not luxury as we understand with the Swarovskis and the crystals and the golden embellishments. It will be like in an intangible luxury or a necessary luxury, and not in the tangible components, but in the intangible benefits of it. Since free time has become a luxury, even so than ever, since we didn't have any free time, or we had all the free time, if you wish, but didn't actually have any free time. Now, really, really is good for me, and really makes me feel happier, makes me feel better, makes me look better. It really is going to be a luxury, but not in the traditional sense that it has to be 5 stars, it has to be, you know, the butler service or whatever it is. It's not that. That's gone. We still have markets. We still have Middle East markets. We still have the Southeast Asian markets. We still have Russian-speaking markets, where the tangible components of luxury is still very, very important. But now we have a large section of the market, and especially I think it's going to be growing significantly, who really appreciate and label some very basic activities as luxury. Just sitting on the beach and enjoying a sunset and having an alcoholic or not beverage in your hand, and at the same time taking and enjoying even the rain in that beach, that's going to be a luxury. So I think we need to redefine luxury. That has been going on now for a while. That's redefining the meaning of luxury, at least redefining it by segments and markets. But I believe the last couple of months really taught us that some very, very basic things can become luxury very, very soon. And then that's a revelation to us. And the markets will respond to that. Again, it's not a mass market thing. Those who wanted to become drunk on the beach still want to become drunk on the beach. But those who really will appreciate the small items, and this is when the well-being, improving, or services, or any item or resource that is local and contributes to your well-being will become as a luxury thing, and guests will label it as luxury. We don't necessarily need to do that. Guests will do it.
Thank you. So I've got another question for you as well. So on the topic of healthy food, we see a shift in consumer demand towards more food that strengthens the immune system and more potassium and higher vitamin C, good for gut and such things. There's a question for Laszlo. Do you see health cuisine gaining more importance in the wellness spectrum?
That's a wonderful question. I think we can repeat it a couple of times. And you know, when someone says healthy food, I start to laugh. Not because it's not an important question, it's because the same item of food item has been labeled healthy or terribly unhealthy in the last 15 years, back and forth, depending on which school you are following, or which medical approach, or with cultural approach, or whatever it is, fashion you are following. I really don't know. Obviously, there is a dietitian understanding of healthy food should be like, but it doesn't necessarily mean that it is pleasurable at the same time. When someone gives you kale juice for the 5th day running in the morning, you will question that, is this really that important to be healthy because it's disgusting? Or not, because you may find out that actually do love kale juice. I don't know. But no, I'm not. Again, don't take this personally. I'm not belittling your question. Just more like it's very difficult to answer your question in the sense of healthy food, because people say that the Mediterranean diet is the one that we all should be pursuing, but some others say that that's very nice, but it makes you fat, or it's a risk that it can make you fat because you're eating a lot of oils. But I think it's more like the measure of anything and the balance of everything. That's more like what healthy diet really is. But again, some people don't eat tomatoes because they grow at night and they take the negative energy of space in. So what do I know? So that can be healthy. I love it, but some others say that it's not healthy at all because spiritually it's a dark food. So I think by now people have access to all sorts of wisdoms and ideas and menus and cards and all that. Service providers would need to think really twice, 5 times, and 10 times what they label as healthy and what kind of options they provide and what kind of allergies they are catering for, because that's becoming a very complicated issue and even a risky issue, having allergies. So yes, health issue is really becoming some hot topic right now. But what is healthy food? That's really up to your guest and probably to yourself to decide what on a Wednesday morning will be labeled as healthy, because it's just such a difficult task. And I wouldn't like to be a food and beverage director at the moment, or even a chef for the matter, because that's a very challenging job. But your question is really spot on. It's a really hot topic.
Thanks. And we're just going to close with one question to both of you. And the question is, thanks to both of you for your thought-provoking presentations. Please can you share your views on travel for immunity building, correcting personal health risk factors, and, apologize if I don't say this correctly, Ayurveda healthcare for disease reversal and or sustained well-being?
Irving, go for it.
Well, I was going to demur to you, Laszlo. First of all, those are robust market segments. Those were robust market segments pre-COVID. And I think once we go through this crucible, this period of disruption and modification of risk versus reward, we're going to see consumers on the other side who are even more sensitive. And what Laszlo is saying about necessary luxury or luxurious necessity, it's defined by the consumer, and health and well-being in the face of a global pandemic strikes one as being extraordinarily important. And on the other side of this particular period, I think we'll see renewed interest in exactly these types of themes. Laszlo?
Absolutely. And not just that, but Ayurveda obviously is an ancient lifestyle approach and philosophy, and which includes the healing aspects, the diet and everything. I think what's important here is the evidence, that you can provide some backup evidence that this has been tested, not just clinically tested, but they tested by time. The grandmothers and the uncles and the ancient citizens have been using certain things for certain benefits. For a certain reason, and not talking about the mumbo jumbo and the shamanistic, very questionable approaches, which some of which also have reference here, but more like, can you provide the necessary evidence that is first of all, it is safe. Second, it's tested clinically, so certainly don't have any kind of risk associated, but I can personally benefit from it. We've just been collecting a large number of well-being or happiness approaches all around the world, from Sweden to Denmark and Japan and Asian countries, Arabic countries, and there are many countries do have the Ikigai and the various other approaches. There's some 20 something I collected recently, and there is a reason for that, and there are some foundations, but And since you mentioned Ayurveda, I would like to refer to this, that often Ayurveda is sold as a treatment and not a medical or a lifestyle approach. It's a fancy spa which does the Ayurveda, which have the sesame oil and blah, blah, blah. And it's lovely and people take it because it's exotic, but it's nothing to do with Ayurveda per se. And when you need to provide those systems, when I said storytelling, when I told you that you have to provide the journeys, again, it's not belittling Ayurveda as such. It's more like how you can introduce it, that there is an evidence, there is a beginning, there's a middle, there's an end to it. It's not a 5-hour training program that you become an Ayurvedic specialist. Ayurvedic doctors being trained for absolute years and practice and all that, and it has the spiritual component. So when you talk about immune boosting treatment services, packages, and opportunities, certainly yes, that's, I think my personal answer is yes, but how you are introducing it and how you are convincing guests as well as service providers, hosts that would provide you the space and facilities to actually deliver those treatments and services. That is the tricky issue here, because a National Health Administration may not approve, the FDA may not approve or haven't yet approved all those interventions, and then it becomes a critical thing. So you need to do your homework a little to understand how anything, even if it's ancient and if it is proven by generations, having a pandemic certainly puts ancient things into a very different category. You know, the bats and the various other things, are they still safe, or can we still trust those things? And also don't forget that we have so many, what's the politically correct word, more like people who make advantage of you trusting some promises. Was it politically correct? I think it probably was.
Opportunists, I would say.
Oh, but yeah, opportunists, and who can sell you anything and everything that it would boost your immunity, it prevent you from getting this and this. The supplement business is probably the best business in the world at the moment, or has been. And to differentiate yourself, so real, you do really know what you're talking about. You have the evidence, you have the protocols, you have the follow-ups that people can pursue it even if they got home from your place. You have to provide that guest journey, otherwise it becomes a, you know, like a little puzzle but not the picture. You would need to provide how it is going to be something that I can practice even when I went back home. It's not just a one treatment which I took 5 times during my stay and then onwards, whatever. I need to go to a lovely, tangible luxury place to refer to the previous person's question. I can't necessarily do it in my home. So certainly yes, but how you do it, that's a tricky issue.
Great. Thank you very much. And to all those, if we didn't answer your question today, we'll be sure to follow up with you afterwards. And thank you all for attending today's webinar. We hope you found it informative. Please do take a moment and tell us how we did. You will be receiving an email shortly with the recording and a link to a very brief survey. This is the only way we can learn to improve our presentation. Thank you once again, and we look forward to seeing you at the future program. Have a great day and stay safe, everyone.
Thank you. Bye.